This is Deja James with Partnership for the Public Good, an organization think tank that works on behalf of community building, policy, and advocacy through research and a couple of other different things like media, like you're watching here today. And we're really excited to be starting out the year. We have a really strong community agenda. And if you don't know what the community agenda process is, we invite our over 360 partners. It's free to be a partner, by the way. So if you want to check it out and see how to become a partner, it's on our website, ppgbuffalo.org. But if you are a partner, you are able to pitch onto an agenda process, community change and policy change you would like to see on the state, county, or city level for Western New York. And we're really, really excited. We finished that process, wrapped it up last year, 2024, and we now have a 2025 agenda. I had the Eastside Parkways Coalition on with me earlier, and you saw that at the top of the year. And now I'm so excited to have another one of our planks this year, the Treatment Not Jail plank, which is working toward diverting people with substance abuse or mental health issues away from the criminal court system, which is really, really important. There is a current system in place, but we're going to talk a little bit about today how that's maybe not working the way it should be. So I'm really excited to have Sophie here with Legal Aid. I'm going to let you introduce yourself, Sophie, and then we'll get into what we're going to talk about today.
Thank you. I'm Sophie Feal. I'm with the Legal Aid Bureau of Buffalo, where I am a managing attorney for the Holistic Representation Project in the Criminal Defense Unit.
Awesome. And what currently, because Treatment Not Jails has been in the New York State kind of Senate and Assembly for a little bit. Yeah. What are you asking from the state currently right now?
Right. The Treatment Not Jail bill, or for short TNJ, is a bill that would basically amend the criminal procedure law as it is today to facilitate the entry of more people into the treatment courts that exist across the state, and would also hopefully make all of the courts consistent in how they approach their goals. Because right now we hear things about a great court in Brooklyn and a not so great court in Buffalo.
Yeah.
And there's no reason they should be operating so differently.
So what is the current status of treatment courts? Maybe we can start in the Buffalo context. Yeah. We do have a treatment court.
We have several, yeah.
How is that currently functioning? If you're someone who maybe got arrested while you were under the influence of drugs, or you have a substance abuse problem, what then happens to you once you're arrested and get, into the system and things like that?
When you enter into the system, the court system, if it's believed that you have either a mental health diagnosis or a substance use disorder, you can ask under most circumstances. Some people are excluded no matter what, and that's one of the changes we hope for, to go into one of the treatment courts. Now, the treatment courts, there's several at Buffalo City Court. There's an opioid intervention court, so that would be for people who use opioids as their drug of choice. Then there's the drug court, which is kind of every other drug. There's the mental health court, and then there's also one for human trafficking and one for DWI, which is usually a compliance court. People go there after they've been convicted to make sure they get the help that they might need in order not to drive drunk again. But the ones we're talking about mostly are the drug court, the mental health court, and the opioid intervention court. So those are for people who don't have serious crimes. They can go in, and they generally, with the exception of opioid court, the other two courts, they go in after they take a plea. So, for example, your lawyer negotiates with the district attorney's office a plea to the charge that you've gotten, right? And then you go into the treatment court, and depending on how well you do, if you're compliant and you go to your programs and you participate and you do everything the way the judge expects it done, then you can withdraw the original plea and plead to something much, much less serious. And maybe you'll get no time at all, okay? In opioid court, they don't even ask them to take a plea. They can just go into the opioid court immediately, and then when they get through the program, then it's decided what they might plea on, which is usually, if someone succeeded, something much, much less serious than what they were originally charged with. Now, one of the big changes that TNJ makes is we want to eliminate the requirement for pleas across the board. In other words, no one would go into treatment courts with pleas.
That's what I was thinking, because either way, it's like you have to confess some sort of guilt or some sort of level, right? And it's interesting that you can then maybe revoke it or, you know, decrease the kind of severity of that charge later. But in the meantime, you have this plea on your record that
well, you have a plea. You haven't been sentenced yet, so you're not convicted.
Okay.
Usually you have to have the two to be actually convicted. But you're right. I mean, we would like to see people get their treatment before they enter pleas at all, because then they're stuck with that plea if they don't, quote unquote, succeed. And here's one of the issues: is what is succeeding when you're in treatment? Well, we know if you talk to doctors and health experts that deal with people, for example, with substance use disorder, we know that relapses are part of it.
Right.
Okay? It's inevitable almost that someone will relapse at some point. Does that automatically make them fail and therefore they're on the hook for that original plea when we know that relapsing is part of the process? What about someone who goes in with an addiction to, say, cocaine? And they've been really good for 6 months, and then one night they go out and smoke pot. Have they failed? And should they be punished? And should they be told to leave the court and therefore be stuck with that plea that they took and the sentence that corresponds to it? So those are some of the concerns we have. Now, I will say that going into the system pre-plea is a sticking point in the bill. It's not the most popular thing, and it usually has to do with the more serious crimes. That at least with more serious crimes, the Senate, at least from what I understand, wants to see some kind of plea up front. There's a sense that if you have a plea, you've at least got someone on a hook. You know what I mean? But it doesn't necessarily follow the notion of treatment.
So I guess my other question is, and I know you said that the drug court is an exception for the plea, but for mental health, how is someone in their right mental capacity to even be making a plea? I guess is my question.
That's a good question. It's the opioid court that's pre-plea. The drug court is post-plea, and mental health court is post-plea. And what you're asking me is, how does someone enter a plea if they have a mental health diagnosis? It depends. If their mental health diagnosis is so severe that they cannot assist in their own defense, there is a process by which the charges can be dropped, or if it's a serious charge, the person would go into some sort of hospital and be what they call restored, so that they can then help in their own defense. But then we're usually talking about people who are in very, very serious shape. They really don't understand the reality around them.
Right.
Those assessments are made by psychiatrists with Erie County. So if someone comes into a courtroom and you can see that they don't know who their defense attorney is, they don't know who the judge is, they don't know what the purpose of this whole process is, they're talking to themselves, they may be put on that path that perhaps they are not in a position to assist in their own defense. It's kind of like when people call it the insanity defense and you know, loosey-goosey terms. But so we're talking about people who are conscious enough about what's happening to them.
Yeah.
But we know that their mental health is not being addressed.
And they're still struggling.
That's what's getting them into trouble.
Right.
Right.
And so you mentioned that, you know, people kind of get a chance, and it sounds like a singular chance. How many chances are people given in this process?
Well, that's a good question, too, because I think it depends on the court, and that's why we think there should be some sort of consistency across the state. There's a theory for treating people with substance use disorder called harm reduction. It is what today people in the field use, and it is about keeping people alive. And you've probably heard of methadone as a harm reduction strategy. In other words, heroin will kill you, so we'll give you methadone because we know we have to address these urges you have. Well, there's a lot of other things that go into harm reduction. Needle exchange programs, safe injection sites, Narcan, lots of things are deemed harm reduction. And not all courts across the state want to use harm reduction as a means to engaging the participants.
I see.
So if they relapse or they use a drug in a harm reduction model, you wouldn't punish them for doing that. You never want to push someone away from the system. You want to keep them engaged. Doctors have told us that keeping people engaged in treatment, even if it takes years, can be what finally gets them to where they have to go. So moving along too fast and punishing people too quickly is not ideal. But then on the other side, from a legal standpoint and due process, how long can you keep people hooked in the court system?
Right.
You know?
Right.
We also know, and social workers and other specialists in the mental health fields and the profession will tell you, you can't help people who don't want to be helped. In other words, who aren't ready to be helped.
Right.
Not everybody says it's my time to give up this drug. So there has to be a balancing of all of these theories, and there has to be a usage of what the medical profession and the behavioral health profession believes are the best protocols. And they have to be used across the state. Because again, I hear certain courts use these methods, others no.
So is it up to, or is it the entire court, or it's like judge by judge?
It's a lot of judge by judge stuff. There's a lot of little judge by judge stuff.
So right now, it's really a judge by judge basis whether they're allowing harm reduction treatments as possible.
That's what I'm getting because, again, I only practice here in Buffalo, but I'll hear from my colleagues in the coalition about things happening in Brooklyn that sound completely different.
Wow.
In a sense, they sound like the judges perhaps are more understanding of the notions of harm reduction and relapse and keeping people engaged, or understanding that some people just aren't ready for this. And where does that all fit in the picture? So I don't think there's consistency, and I think that part of what we want is a consistent treatment model.
And the timelines of treatments as well?
Well, the timeline of treatment would probably be based more on a medical model than any other kind of model.
Okay.
Within the parameters of what the legal system can do.
Right.
It's kind of putting two areas together that don't always fit really well together.
Of
you know,
course.
operate under different paradigms, the legal profession and the medical profession. But I think, you know, there's a lot of solid ideas about how this would be implemented if it were passed. Part of it, too, is making sure that we as a state can have enough people to serve this community that needs this kind of help. Because, as you know, there's a dreadful shortage of mental health professionals everywhere, but definitely in New York State. And I know that the governor had made it a big priority. But we have to keep looking at that and also the resources that we'd want to put into this.
Now, would this help for areas that, I'm assuming not all areas in New York State have treatment courts in general?
Small rural areas probably don't.
Okay.
But some suburban places, courts have them. City courts, the large cities, of course, all do.
Okay.
As a matter of fact, Buffalo and Rochester were really pioneers in the treatment courts. And the idea is solid. It was a good idea. That it was the idea of not just punishing people for these situations and understanding that something else was bringing them into the criminal justice system. And it wasn't necessarily, you know, they're bad. It was simply that they were addressing a certain need or a certain disability. And we have to see substance use, obviously, as a disability.
Yeah. And so I know you said one of the sticking points for maybe the state Senate or some other elected officials may be the plea portion of it. What else are you asking for, you know, in the, what other standardization are you trying to implement?
We're asking for everyone to have the opportunity to go in. That's a sticking point when we get to very high level crimes like rape and homicides. Our hope is that nobody would be excluded if they had, if they fit the requirements to get into the treatment court. And of course, an initial assessment would be made somewhere along the line. and that perhaps those charges would not be fully dismissed, like, a petty larceny if you're successful. But we would we would hope that at least the guidelines would not be followed. So you wouldn't have the mandatory minimum imposed if someone was successful in treatment, and there could be more discretion in terms of what sentences would be imposed. But that is also an issue. As a matter of fact, there has been some discussion about treatment, not jail, not being the best name, because it implies that no one's going to go to jail.
You're not going to go to jail.
And society as a whole believes in jail. That's a whole other discussion.
Yes, it is.
That paradigm is a whole other discussion. But within the framework that exists, we're a very punitive society. So it's hard to get people away from thinking about jail.
That's so tough because especially, and we know we've had different drug crises. It's changed. It's the crack epidemic.
Always.
It's the opioid crisis. It's, it just seems like there's all these different iterations. And we see so many generations impacted.
Yeah, and let's be honest that they're not all treated the same. We know that very well. I mean, the discrepancy between crack and powder cocaine at the time was huge. The punishment against crack versus the punishment against cocaine. Cocaine was a white drug.
Well, I love what you brought up, and I think it was in one of the pitch. I don't know when you brought it up, but you were saying why it's called opioid court and why the opioid court came into existence. Like, we never had a crack treatment court.
No, we never had there was never a crack treatment court. And even the opioid treatment court, there is, and again, I don't know statistics, this is just kind of what people say, is if you, the opioid treatment court, which is the pre-plea court, tends to serve mostly white people. You get a lot of suburbanites who got hooked on opioids with the OxyContin and the painkillers, and then the drug court tends to be people of color who are not necessarily using the same drug, but are equally have the same disease and the same disability. So that is also something that I think we need to look at very, very carefully, is if you can have pre-plea in one court, why is it so offensive to have pre-plea as a whole? What bothers you? What's really bothering you here?
Right. What's the undertone?
Well, that's the only thing I can come up with, is because we know it happens that there's pre-plea. I will add, as a side note, that pre-plea is also better for non-citizens because of the way the immigration system is set up, that treatment courts aren't necessarily good for immigrants or non-citizens because even though they can withdraw their plea,
if they even have one,
once they have one in and once they're sent to treatment court, boom, they've got a conviction that could make them deportable. So there's that part of being pre-plea that's also a side note that's important.
Which is like why you're trying to get rid of that plea arrangement.
I don't even think that was the reason in TNJ, at least, but it is something that those of us who advocate for immigrants have come to recognize, that pre-plea is very important.
Very useful, right? And so are there stipulations now in terms of, if someone goes through treatment court, they made it through their first process, they got a lower plea, went back out. And as you said, a part of recovery is you may or may not relapse. And so let's say they end up back in court, right, after they've already been. Do they get another chance?
It depends. I mean, usually they do. I will say that most of the judges don't say, hey, you messed up once, I'm sentencing you to, a year in jail. It's over, buddy.
Yeah.
I mean, usually there is some recognition that people relapse, that people have bad days, that certain things happen in people's lives where they go back to their old coping mechanisms. You see it all in treatment court. People lose family, so they don't know what to do, and suddenly that drug that was always their crutch comes back. And so those kinds of things are recognized. They're just recognized differently from court to court to court. Right. And I think there has to be more consistency. One of the areas that does come up is the use of marijuana now that it's legal. And when people are addicted to another substance, and for example, you have PTSD. PTSD is your mental illness, for example, or part of it. And your doctor thinks that marijuana could help you. Well, the treatment courts are zero tolerance as they run today in Buffalo. Except for the opioid court because they allow for Suboxone and methadone. But the other treatment courts are zero tolerance. So smoking marijuana is a violation of the terms of treatment court. And so we have to sit back sometimes and say, does that make sense? When your doctor has prescribed this to you and other prescription drugs are okay.
Is it the fact that marijuana, even though it's legalized, may or may not be officially medically utilized for some people?
Well,
like unless it's prescribed?
I think it's because it is a drug that alters your perception. So does alcohol, though, too.
Right.
But even alcohol is zero tolerance. You shouldn't be using alcohol. But I don't know. Harm reduction, what if this is what it takes to save that person's life and to keep them from using another drug that could kill them, like something with fentanyl in it?
Yeah.
I don't know. These are complex questions, and I actually have another grant that's allowing me to explore them a little bit more with experts. So I'm learning a great deal about how substance use in particular is treated. And it's really quite eye-opening in terms of the effort that's involved and the fact that we really as a society need to start looking at this as a disease, and it's the idea that a diabetic's blood sugar goes up and down all the time, and nobody says, oh my God, you bad person, your blood sugar's up high, get out of my practice, I'm not going to help you anymore.
Right.
Same thing with substance use. There are bad days.
And I just think that, doing this work with PPG and seeing how we can reimagine systems and how we're reimagining society, you're not always going to get the 100% product right away.
No,
I think what you seem to be saying is it's like treatment courts are great and it's amazing that we have them. We need to make sure we're increasing accessibility to them and running them in a way that makes sense from a medical perspective and all of those things. And so tweaking this system, tweaking these courts isn't, a denotion of failure in any sense, but it's a matter of just, proper evolution.
As we learn more. And it's also, I think there is an element of breaking the paradigm of incarceration too. I mean, there has to be something like, as we go on and on and on, years and years as a society and realizing that throwing however many percentage of our citizens into jails, it's just not working for us.
At all.
At all. I mean, this isn't the answer. There are, we have to look at where crime happens, how it happens, why it happens, and deal with the underlying roots. And we can't just throw people in jail all the time. People steal because they have an addiction that developed. And their brain got wired differently than mine or yours. Yeah. And answering everything by, locking people up is just not the answer. So it's part of that. Although I don't want, it's within the scope of treatment there. I'm probably covering a larger issue than I should.
No,
it's so important.
These are our larger systemic issues that we have to face. And I mean, we can keep, reforming and doing things all we want, but we're kind of skirting around the issue at a certain point. Like carceral justice is very much something that we need to be thinking about and need to be implementing. But in the meantime, there are things that we can be doing so there's not so many people being funneled into our jail system.
Jails are terribly traumatic places. Take a person with a mental health diagnosis and put them in a jail. You've done nothing for them. Take someone with a substance use disorder and throw them in a jail. First of all, they're going to get access to those drugs. It's naive to think they're not in there. So they're not going to get any treatment, or they're going to get treatment in the most horrible way imaginable. It makes no sense. It makes no sense. It's not where people belong. And I don't purport to have all the answers, especially since I'm not even medically trained. But, I have spoken to doctors who've given me access to written information, studies from other countries about lots of harm reduction practices that are really working and are good for the communities in which the people live, do reduce crime, do save lives. Fentanyl is right now our worst enemy in terms of illicit drugs on the streets, and it kills. And if we don't start addressing people's needs, we're just going to watch them die from fentanyl poisoning and overdoses.
It's really tragic. And, you know, we've gone through a couple of different crises where we're just willing to sacrifice a large, vast number of our population and kind of turn a blind eye to it. And I think, you know, sometimes people feel like, well, what can we be doing about it, you know? And we have more power than we think.
We have a lot more power than we think. And we have a lot more money and resources in this country.
That's the other thing.
And prison costs a lot of money.
It costs a ton. People complain about how their tax dollars are being spent.
Erie County, okay? Bear with me.
No,
I've got
please.
a number about money. It costs $227,551 in 2021 in Erie County to incarcerate someone.
One person.
One person annually. It's a lot of money. There'd be a lot of treatment there, too, you know? There's potential for a lot of treatment and a lot of support. So, you know, these are important things. We, in terms of Western New York support, John Rivera has sponsored, but we have not gotten anyone else in the Western New York delegation to sponsor us at this
And we've had a little bit of a shakeup, so hoping some of that will help.
Some of the shakeup will help. Yeah. Absolutely, that's a very good point.
Yeah.
I mean, we had Monica Wallace's ear. She was very interested when she was still in the legislature, but we'll see. I mean, I'm looking forward to speaking to people. We have a lobby day coming up on January 21st. What I want people to know is that this is a huge coalition of super interesting people. It's a statewide coalition, and because New York is so much of a part of our state, a lot of them are New Yorkers, but they're lawyers, they're social workers, they're people with living experience, they're the parents and loved ones of people with living experience, there's ministers. There's just so many people in our coalition, and they're all over the state. And when they go to Albany on the lobby days every year, you know, they all come together. A big busload comes from New York, and then the rest of us try to get there any way we can. So there's a lot of support for this, and we have gotten some great endorsements, including the we're in the 2025 People's Budget of the Black, Puerto Rican, Hispanic, and Asian caucus of the legislature.
Amazing.
We have the New York City Bar has supported us, and some of them, there's a mental health organization also that has supported us. So little by little, you know, we've made some headway over the few years. I've only been involved for a couple years, and I know they've been at it for a little longer. And we keep hoping this is our year.
It's going to be your year.
I hope so. Now we got PPG.
Yeah, we're going to get it over the finish line.
There you go.
Along with all of you.
Yes.
And as Sophie mentioned, there is a lobby day coming up. I think when this episode airs and when you're going to be watching it, it will be a week from when you're watching this. So if you want more information, we're going to make sure in the description on Instagram, Facebook, YouTube, wherever you're watching this, that you can get the information from the TNJ Coalition, and making sure that you are plugged in and that you can get more information as this campaign proceeds. The state session is just now starting, so it's time to hit the ground running.
That's right.
And get it going, and we got to get it done. This is a budget ask, or is it legislative ask? Do you know?
Legislative ask.
It is a legislative, so we have even longer. Good. So we got a couple months. When it's budget, it cuts short because they finish the budget first. Anyway, I'll talk about that maybe in another episode.
Yeah,
but,
I would like to learn that.
Yeah, but we're really, really excited for you all to be on the community agenda this year, and I'm really excited to have had you as a guest, Sophie.
I appreciate
I really
it. I wish
appreciate
more
you
of us
coming.
could have been here. We're really a great coalition, and we meet every other Thursday online, so anyone is welcome to join us
Absolutely.
at the meetings and learn a little bit more and see, you know, the dynamics and the excitement there is among membership to have this happen, and especially the personal stories are really quite striking.
Yeah, and I've heard some from, you know, people with direct experience, and it really, it's really just an important coalition, important bill, and we need to get it done.
Yeah.
So Thank you so much, Sophie, once again
Thank
for
you.
being on with me. This has been The Public Good with Deja James from Partnership for the Public Good. I appreciate you for watching this episode today. I hope that you learned a little bit more about our court systems and how we can be doing better for people in our community. If you want to learn more, go to ppgbuffalo.org. You'll be able to see our entire community agenda for 2025 there. And we're really excited on January 17th. We're going to have a public rollout and announcement where hopefully I think Sophie's going to be there, and we're going to have some other people from the coalitions as well. So we're really excited. Thank you so much. This has been Deja from PPG, and see you later.